Kia ora, I'm Danny Delore. I'm a general paediatrician from Aotearoa, and I chair the working group that has developed the RACP position statement on Indigenous child health. The statement describes the current health of Indigenous children in both countries, and it examines some of the factors that contribute to the health of Indigenous children, and some of those are factors that exist within health services. Some of them are challenging, things like the impact of privilege, of colonisation, of cognitive biases and institutional racism. But it offers approaches that paediatricians can use to counteract the influence these factors have on the health and well-being of Indigenous children. Some of the messages that come out of the position statement are that Indigenous children have a right to the same standard of health as other children, and the RACP affirms its commitment to the elimination of the health inequities Indigenous children currently experience. We have tremendous potential to contribute to the elimination of those inequities. I believe most paediatricians underestimate the influence they can have. We would like paediatricians to be familiar and comfortable with the concepts of cultural safety, cultural competency, institutional racism, privilege, unconscious bias, and the impact of colonisation, so that you can talk about these things with your colleagues, discuss it with and teach with trainees and medical students. We'd like you to consider equity in all aspects of how you practice medicine and how your service operates. We would like paediatricians to keep learning about the history of their country and to learn about the knowledge and beauty that Aboriginal, Torres Strait Island and Māori culture has to share with us and to teach us. The RACP recognises that Indigenous healthcare works best when designed and delivered by Indigenous people. But we'd like paediatricians to form relationships with Indigenous health services so that they can support those services and so that those services can support you. The RACP prioritises the development of an Indigenous physician workforce that mirrors the general population. Attracting young Indigenous doctors to our college requires us to be a culturally safe college, and it requires you to create work environments that Indigenous doctors want to come and be part of. The statement tells you where to find resources that will help you, including very good RACP online learning resources for cultural competency and cultural safety. Remembering that just like our ability to communicate effectively and to teach well, development of cultural safety and competency skills is a career-long process. I encourage you and other healthcare professionals to read the statement, to discuss it with your colleagues, to refer back to it and use it as a guide to help you contribute to the health and well-being of Indigenous children.